everybody.
Morning.
Welcome to the Medicare Cafe. We should get a jingle.
A little jingle
We
this
should
morning.
do a jingle. I'm excited. Listen, I was at deer
I
camp
played
this
the piano
weekend.
for several years. I
played the piano too when I was like 6 until I was like 8. So like not a
Okay,
lot.
I was like 6 to like 15.
Okay, so you're probably a little more skilled than me. I
don't know. It's been a few years.
What other? We'll get to you. Hold on. What other instruments do you play?
That was it.
Just the piano?
Mhm.
It'll tickle the ivories. I don't like
Yep.
that. I played piano for a couple years. I can
Okay.
do a mean hot cross bun. I played saxophone and I played guitar.
Wow.
Mhm.
Nope, just the piano
Not
for
with
me.
these claws. I
Just
have
the
to have
piano
short
for me.
nails.
Yeah.
Just the piano. I don't do any of them well. It's like I have ADHD, but with instruments. Like, oh, this is fun. Nope,
Just
nope,
dabble
nope,
in
never
this,
one.
dabble in that. I could see you doing that.
Truly. Welcome to the Medicare Cafe, y'all. We're going to get started. Well, it is at the top of the hour,
It is
but
now.
luckily for you guys, if you have any questions, comments, concerns, thoughts, or promises, you have 2 options. Number 1, text that number. Even if you're watching the recorded version of this, text it at any time, and I'm more than happy. Again, that is my cell phone number. So I always try to make sure that I get back to everybody at least within 24 hours. It is an EP, so bear with me. Or number 2, if you want to answer right here, right now, forget about it. Go ahead and comment on our live section as well, so we can read those and get back to you.
Speaking of getting back to people, when is it going to be known across the world that AEP is our tax season? And that, like if I reached out to my accountant in March and I didn't get an answer for a day or 2 days or a week, like that's normal.
I understand.
Why can't we get that same,
Yeah, why don't people love us? It's true. Well, and
like
again,
it's known, like you don't hear
I'm
from your
busy.
accountant.
I was at
Somebody from their office will call you, but for us, that's not okay.
Yes.
Like you have to call back
immediately
within 6 hours or it's death.
Well, and again, like good and bad. Good because it's like, okay, I'm a sunny side looking at the rainbow. Like it just shows like how much people still depend on us, and that depending on us is job security. Will continue to prove that people should not be enrolling themselves, shopping themselves. They need to be working with an experienced person. But also, like, again, I would expect that this year more than ever, just because I'll tell you, I had deer camp. If you guys are in Missouri, our rifle season started last Saturday, and I had several people there that know what I do, and because we host deer camp every year, had several people that like know that like she's like, oh, Olivia, she's like somebody at something with insurance. I will tell you, so many people came to me this weekend. They're like, tell me what the hell is
Really?
like saying like, one, I'm getting called 50 times a day. I'm
Yep.
getting so many things. My TV won't shut up about it.
Yep.
But like, should I be scared? Like I heard that question. Should I be scared? Like 3 or 4 times.
It has to be from the election.
It has to be. And that was the one I was like, is
can't
Trump
tell
gonna
you.
turn off my Medicare?
The amount of times
Mm-hmm.
I have had that conversation, like I'm surprised I have hair left.
Yeah.
Because like, I'm not kidding, over 20 people
Yeah.
walked in and were like, am I going to have Medicare next year?
Mm-hmm.
Am I going to have Medicare and Social Security? I'm like, yes. Yes, you are.
Truly.
Like,
Truly.
you are.
People just be scared. I mean, I get it. But again,
I know, but
all press is
Ugh.
good press, right? Like, so it's
Yes.
good that like people are talking about it. Again, it's frustrating. Again, I'm a silver lining girl. When we get off of here, we can just like go punch like a tiger or something if it makes you feel better.
Okay.
But like, I don't know. I was gonna say a
punch a
puppy.
piggyback here.
Oh, Henry.
I'm just kidding.
Oh, hurt Henry. Nothing. But yeah, it is truly like the more it's talked about, the more it's frustrating. The more your phone rings, proves the longevity of our careers. So embrace it. I know it
was just
sucks.
curious.
I'm trying to make it better, and I
Just
know
curious
it sucks.
when we're gonna get that. And I would say like 75% of my clients like give me like extreme grace.
Oh,
But
extreme grace. I like
there's
that.
a handful of people who like
Truly
they need
no.
a response within hours.
I mean, they're scared. I mean, they truly.
Yeah.
A lot of people are truly, really scared and panicky, and that's why you're here, is to guide the poor, the weak, scared, the hungry.
I had
their
to
Medicare
I had to tell a new client that she might need to look for another agent.
Carrie, I'm proud of you. You have to fire clients sometimes. I'm
She
proud of
literally got mad at me. So in the like 12 hours that I had known her.
I love her.
She had emailed me like 16 times. And like each thought was a new subject line email. So it's not like everything was in a thread. And so like I had missed one of her questions in the like 16 separate emails.
Oh no, baby girl.
And she was like, it has been 24 hours and you have not answered my question from yesterday about dinner. And I was like, if I pride myself on having really good customer service and really good communication. So if what I have done is not to your liking, you might want to find another agent.
Good for you. We should do an episode on how to fire a client.
So,
because I mean, like it is.
She's
true.
still with me, but
yeah,
I kind of wish she wasn't.
Kind of wish she wasn't.
Anyways.
So during AEP, guys, we keep these calls as short as we possibly can.
This is just a rant sesh today. Is that what it is?
It truly is. It's just like, what's going on? So I have a couple updates for everybody.
Because I don't know what we're talking about, but I'm just ranting.
We're in it. We've been doing it for the last 5 minutes, talking about it. What's going on this AEP? What are you as agents hearing? What's going on in the industry? Let us know. Again, text or live chat us and ask us your questions. I do always reach out to our agent resources team. They are the front lines. They're the ones, if you call our number and you say, I have a question, you're getting sent to agent resources to kind of be asked, what are your top trends, top questions that we're seeing right now? Before we get to that, you said you had a Part B question.
Oh, yeah, this was a new one. This was a
I'm
really
not gonna
interesting
like it.
one. He's 75.
Crab.
Called me this morning, and he was like, I've only had Part A. I don't want Part B because I don't want the government paying for my needs. But he said, I need a hip replacement. So I'm going to sign up for Part B in January, it'll be effect February, have my hip replacement in February, and then cancel it in March. And he was like, I know I'll face a penalty, but it'll just be for the month of February, right?
Well,
and I was like, I think so, because
my question to that would be, can you disenroll from Part B once you're enrolled without another form of credible coverage? Will they allow you to disenroll? And I would
what are they going to do? Like,
the answer would have to be like, yeah, what are you going to do? I mean, except for continue to keep enrolled and withdrawing from a Social Security.
Yeah, I don't know.
Because the rules on like withdrawing from Part B is if you have another form of credible coverage you would like to withdraw from Part B, you can do so. But that might just be referring to avoid the penalty.
Right.
And I mean, he's going to have more than just February, because if he's getting a knee replacement, you said, he's going to have occupational and physical therapy that has to be covered under Medicare.
He'll pay
Part B.
for it all, and he said he knows the 20% he'll be responsible for.
I mean, so what's the question? Is
the penalty, like, just can he do all that, and will the penalty continue past February if he cancels his Part B after his surgery?
I mean, if he's not taking Part B, then he's not taking the penalty.
Right, that's what I would think.
Oh, I don't understand,
I know.
people. I don't
either.
understand. What's the purpose? Just because he doesn't want the government? Well, you're on Part A.
And he's super healthy.
But he's on Part A. It's happening.
Yeah.
If you're doing it.
He says he's super healthy and he doesn't go to the doctor, but he really needs a hip replacement.
Well, then you're not super healthy and you do need to go to the doctor.
I don't know.
I mean, people be crazy, but
yes.
The only part of it that I would want to double check is, what does it look like to disenroll from Medicare Part B if you don't have another form of credible medical coverage?
Who would I call?
Social Security.
Because that's what
I was like. Answer.
This morning I was like, I'll be with someone at 10 who might know the answer, and he was like, oh, I bet they'll be excited for your what did he say? For your very unique question or something.
This is not an award you want to win. Okay. Who can have the most outlandish, bizarre situation in question? That's not an award as a consumer that you're going to be like, was I?
Yeah.
Wild. Okay. Yeah. Well, that would be my number one question is, what does it look like to disenroll when you don't have another form of credible coverage?
Exciting referral, though.
Ooh.
Because he came from the billing department at the orthopedic group.
So we have to take care of him.
Which I've been trying to get into.
Yeah. Okay. I care more now.
So... It's a win.
It is a win.
It's a small one, but it's a weird small win.
We'll get it. We'll get the answers. That's my first step, would be calling Social Security and asking the process to disenroll from Medicare Part B.
Okay.
And if you have to prove credible coverage in order to I wouldn't think so, but like if I'm not 100%, then I have to double check.
Force you to have health insurance.
No.
Right? Like you can't be forced.
No. I would think so. No.
I know you can't just separate Social Security from Part A.
But like a Medicare Advantage plan, you have to have a reason for disenrollment. You can't just disenroll from an MA plan whenever you want. There has to be an SEP that allows for disenrollment. AKA OEP. Like that's why OEP. Right. And before OEP is the annual disenrollment period. So something to look into.
Yeah.
Other carrier updates. I just want to give you guys some things. I have a call every Friday that with the mothership, AKA Integrity, that goes over what's going on in the industry. What are the carriers asking for? What are the carriers saying? So I just want to give you a quick update by the big 7. I'm talking about 7 national carriers, just kind of what these carriers are talking about. Obviously, a ton of movement in non-commissioned plans and a ton of movement in suppressed plans. We talked about that a little bit in a webinar we did last week called Extending Your AEP. But that's obviously just like the topic right now. Yep. Major, I know in Ohio, there was a major one that just went full non-commissionable effective on Sunday. So we're seeing a ton of that, and I think we're going to continue to see a ton of that. If you have questions about why that's happening, we did a Medicare Cafe on it 2 weeks ago to kind of tell you why you can expect to see this and if you can continue or if you can expect to see more. But United Healthcare has overall overwhelmingly been the winner this AEP, the largest carrier, seeing crazy jumps in new business. But 76% of their sales is coming from their external channels. So like any other Medicare Advantage company, they have their
mean? Like agents?
Exactly. So every Medicare Advantage plan will have like their own call centers that like a person can call United Healthcare directly, circumvent getting an agent, and just work with that carrier. It's a pretty significant shift. It used to be that the EDC, the external distribution channel, that's us, was really low, like 30 to 50, 30 to 40. I remember we got to 50. That was just a couple years ago. We're 76%. So UHC has a lot of motivation to continue to support their external channel. That's huge.
Because of Aetna and Anthem's network and service area reduction.
It could, I mean, it's crazy. They said 61% is non-SNP, 26% is D-SNP, and 13% is C-SNP. So seeing a good mix of business as well. I'm loving those C-SNP numbers, seeing those jump up, those chronic plans. That's really exciting. Continue, if you don't know about chronic plans, you need to. Continue to research into those. But yeah, they're really excited. They did have to go suppressed in a couple areas, not anywhere in the Midwest. They did have to go suppressed, but not expecting anything to be non-commissioned. Very excited for that.
Yeah.
Cigna, they have these micro markets. I love working with Cigna because their reporting is like second to none. They're amazing.
Well, they need to fix their provider portal.
Their provider portal is a mess. Truly,
a mess.
Truly. And they know that. But this is where they're telling us their micro markets are Houston, Texas, Central Arizona, Dallas, Birmingham Valley, Nashville, Charlotte, Philadelphia, Mobile, and Chicago. So a lot in that southeast, the southern area.
What is a micro market?
Micro markets means that like we could say like the state, but like within the state. It's not just the Midwest, the Southeast, the Northwest. You know, it's saying like here specifically where those are. So that's really exciting. That's what they're saying. They just don't have the footprint. They have a lot of opportunity there. They need more agents selling there. Devoted. If you guys are new to Devoted was a regional carrier that went large. They are one regional carrier that's trying to go national. They had a huge year last year, and some of their markets where they call their legacy markets, they may have taken a step back, but they expect to win a lot of that back in OEP. But where they've expanded, they're having an incredible year.
Oh, that's good.
So they're very, very exciting.
I've only been asked once about it.
Yeah. There were a plan that they were at a 5-star rating for as long as they've been around because of the craziness that happened to star ratings. They're not at 4.5 in most of their areas. So about as high as you can get right now. Not an SEP, but they said Colorado, their give back PPO and full dual in El Paso and Denver counties, and then Alabama. They're having a lot of success in Alabama. So good to know. A couple more. I'm just going to pass to Aetna. Aetna is one. Again, California, Florida, and Arizona having crazy success with. St. Louis, we're seeing a ton of Aetna plans. Aetna really anticipated taking big steps back this year. Again, we only have like 2.5 weeks of AEP.
I've done more Aetna enrollment than any years past.
And last year was the biggest blow up. Everybody came out shocking everybody. They're still continuing. They're seeing about a 20% drop.
Every single
following
move,
last year, that's insane.
Every single move to Aetna has been from UHC because UHC decreased their dental, so they're moving to Aetna for better dental. All of them.
There you go. And we were seeing that a lot. Dental, what was really interesting, Devoted actually talked about their dental benefits. It was like less than 50% of people actually use the benefits. So that's why Devoted took a big step back in their dental, because they said people ask about it, but they're not using it. They said it was like less than 50% of people actually took advantage of it. Last thing I'm going to mention, 2 more carriers. Humana is also having a really good year. Last year was like a banner year for them. Seeing a lot of that there. Reminder with Humana, there's no deductible on tier 1 and 2 medications. So, and then non-specialty plans. They still have a PPO with a give back plan. So people are really excited about that. Last but not least, Anthem. The top markets by percentage growth is in Georgia, New Hampshire, Virginia, Maine, Texas, New York, Ohio, and Indiana. Ohio is getting beat up right now with a ton of opportunities. So if you're an Ohio agent, you're probably swimming in opportunity, but their biggest plan just did go non-commissionable. So we're expecting to see Elevance, and we're expecting to see United Healthcare really blow up there. Focus markets for them, Virginia, Kentucky, California, and Texas. Those are my updates as far as carriers are concerned and what carriers are seeing out there in the field right now.
I feel like I agree with all of that.
Yeah, does that make sense?
Mm-hmm. Except Humana. I haven't had a surge in Humana.
We're seeing a huge
But
surge.
I know our Macon office.
Macon? I love the Macon office. We're seeing, I've got us internally, we're seeing our biggest jumps right now are Humana and UHC. Yeah, we're seeing a ton, obviously. I want to give you guys one last point. Check out our blog post. Senior Marketing Specialist does publish a blog. Right now, our latest blog has been the latest scams, the nationwide scams going on. Mm-hmm. Eventbrite and TSA PreCheck. Both of them have major scams going on that their people are. Not that they've been hacked, but there are Eventbrite emails or TSA PreCheck emails going out that look legit. And they're not. So it's not like the company was hacked or anything. Mm-hmm. It's just that it's travel time and it's people are buying tickets for concerts and shows and things like that. And so it's that time of year. So just making sure that people are reminded about how to avoid scams. There are email scams right now, asking for credit card information, updating information. So just make sure your clients are aware of that. Check out the blog. And then last but not least, I want to let everybody know that you mentioned this last time. Medicare supplement carriers are seeing a huge jump in GI business due to all the service area reductions. Sure. And they're kind of freaking out because that's, not great for their actuaries whenever you're having to take on a bunch of risk. Yep. So MedSup companies, we're going to continue to see the MedSup market kind of find this new
increase in premiums.
We're going to continue to see some major increases in premiums, guys, and kind of find out what does the Medicare supplement look like in 2025, 2026, and beyond. Just a reminder that if your clients are healthy, and even though they are eligible for guarantee issue, you might try to underwrite them into a plan N. Don't underwrite them if they're guarantee issue for a plan G or F. Right, don't underwrite them. That is against the Department of Insurance. That is against state regulations. Don't do that. But plan N is not guarantee issue. So if your client wants a plan F or a plan G, get them on there. Like, do what's best for your client. But if your client is interested in having much more stable rates and lower premium, try to underwrite them in that plan N. If that doesn't work, then go ahead and GI them into a plan.
Or I had somebody who was GI'd into an F, but I underwrote them into a G.
Exactly. Keep in mind, macro rules do apply here. So if they were eligible for Medicare prior to 2020, then they get plans A, B, C, F, K, and L. That excludes G, that excludes N. If they are eligible for Medicare after 2020, they get A, B, D, G, K, and L. F and C are no longer options for them. So just keep that in mind. That's it. That's all I have. Try to keep these short and sweet and simple. Appreciate you guys. Appreciate the questions that you have. If you want to see us address more information on the Medicare Cafe, join us on our Facebook group. Ask questions there. We'll make sure to address anything you want. Of course, you can always text that number. That is my cell phone. That is my son. That is my cell phone. And text me at any time.
Do we have any texts?
I didn't. No, I kept my eyes on it. Didn't see any text messages come in. But again, if you're watching the recorded version of this, you want some clarifications, shoot me a text. I'll be happy to answer.
We really only have like 2 weeks left. Next week.
I got an email today. It says we have 2.5 weeks. Right. We have 2.5 weeks of AEP. And remember, CMS is on their shutdown right now. So if you're having apps pending at the carriers because CMS hasn't reviewed them yet, they do this every year. I don't know why.
Wait, what?
CMS shuts down in November every single year to do a maintenance and an audit on themselves. It happens every year. If you've not noticed it, you're not going to notice it this year. But if you're seeing that a lot of your apps are not pending with a carrier, but pending at CMS, it's because they're not
Part B.
No, for Medicare Part D and Part C plans.
Oh.
CMS is on a shutdown.
Okay.
They do this
a ton
every
of
year.
people waiting an extra long time for Part B, I feel like.
That would be more that would also, I mean, I thought the Social Security level, but yeah, they run it through Medicare and CMS is on a shutdown right now. Again, it's every single year. This is not new. They do it every single year. It should be done this week, I think.
Okay.
But it's usually beginning of November. They shut it down for a couple weeks.
Makes sense.
Mm-hmm.
Not.
Appreciate you guys. Until next time, have fun.
Make money.
And give impeccable service.